Senate Republican leaders hoped they could present a unified front when releasing a new draft of proposed health care legislation on July 13th, but their plans were thrown into turmoil when two moderate Republican senators revealed their own competing health care plan live on CNN.
We're going to support Mitch's effort with his new plan, but we want an alternative, and we're going to see which one can get 50 votes. We're not undercutting Mitch, he's not undercutting us.
Senator Bill Cassidy of Louisiana and Senator Lindsey Graham of South Carolina say they want to scrap Majority Leader Mitch McConnell's plan in favor of one that would give federal funding to states, letting them decide what to do with it.
The states can decide what they want to do. A blue state can do a blue thing, a red state, a red thing. My state is going to repeal and replace Obamacare with something which gives power to the patient.
McConnell's own plan, which has been repeatedly revised in attempts to make it palatable enough to Republicans that it could pass, has some significant changes from its last version. It would incorporate parts of a controversial proposal from Senator Ted Cruz of Texas that would allow insurers to sell plans that don't comply with Obamacare's coverage requirements, such as mandated coverage of preventive care and mental and substance abuse treatment, as long as they offer at least one plan that does. Republicans have been arguing for years that Obamacare is a failed system.
The health insurance market is imploding. Premiums are going up, co-payments are going up, deductibles are going up. So we have to solve the current crisis. And I think repealing and then delaying the replacement doesn't work.
But Democrats counter that their proposals would cause insurance rates to go up and cause millions of Americans to lose their insurance altogether.
The problem the Republicans are having with health care is not time, it's the substance of the bill. They can spend 2 more weeks, 2 more months, 2 years. As long as this bill continues to cut taxes on the very wealthy and hurt working Americans, the bill's going to be as unpopular as it is today.
A recent poll showed that only about 1 in 5 Americans approves of the job Republicans are doing on health care. And even President Trump admits it's hard to get the Senate to come to a consensus, though he was optimistic that a bill will eventually be passed.
So we have a plan that if we get it approved, it's very tough. Every state is different, every senator is different. I think this has a chance to be a great health care at a reasonable cost. People can save a lot of money. We get rid of the mandates, we get rid of so much. Got rid of a lot of the taxes. All of the bad parts of Obamacare are gone. Essentially, it's a repeal and replace.